Hello, hello, hello. Let me take these off. I can see better what I got them on. Just wanted to come do a quick check-in to say hello to everyone and um, give you info on my pre-operative appointment that I had today with the plastic surgeon. It went pretty good. Just a lot of him telling me that I was approved. I don't know if I told you guys I was approved, but I was approved for the panty and the breast reduction. So, and then she did put in for to have my belly button relocated or something, so that would help them to be able to pull the top part of the stomach down. But she said she wasn't seeing that part on the thing, but she would check into it to make sure to see if that was part of approval too. But definitely the insurance approved for me to have the panty and the breast reduction, which I asked her would the breast reduction also be a lift, and she said yes, it would be lifted. So and that's that. So it was them giving me a lot of you know how the surgeons do tell you what the complications are and things like that, and what exactly they're going to do and where they're going to cut and where your marks are going to be and all those type of things. The one thing that I have to do before, like right now, which I'll probably do tomorrow, is go get another mammogram, because I had one a while ago and it was abnormal. Then I had to go in, they had to retest it, and he said, like, I was okay, like it's okay. And he think, it was because of my the loose skin and losing so much weight. But they seen that and they said just get another one to make sure. So she wants me to do, even though they had told me not to come back for 6 months, but she said that she wants to do it before they do the breast surgery. So I have to do that, and then she gave me blood work which has to be done a month before I have the surgery. So, and someone is supposed to call me with a date. The scheduler is supposed to call me with a date, which she said will probably be sometime in September, because that's when they were scheduling people. So I don't know. I'm just looking at it. If it's meant to be, it'll be. So I'm gonna get the work done that she wants me to do, and I'm gonna wait for someone to call me back, and we'll go from there. I did talk with the surgeon, that does it. He just talked a little bit. He more or less let me talk to the, what is it, the physician assistant, the PA. He came in for a little while, and talked, a little bit, but he didn't do like most of the talking. And they also gave me the surgical wash, which they told me day before surgery I have to wash with this, and the day before and then the morning of. So this, whatever it is, surgical scrub. So she gave me this. So she said, keep that, because you'll definitely have to wash with that the day before, the night before, and the morning of. So, and I asked her because I hear when I'm watching a lot of videos, I see a lot of people say they went home. And I asked her, will I be going home the same day? And she told me, no, I'll be staying at least one night. So, to make sure I have someone to be able to bring me and someone to be able to drive me home in the morning. And she said that the drains that I will have in my breast will be taken out before I go home, but the drains that I will have in my stomach area will be in for 2 to 3 weeks. So she said, prepare for that. And she also said that I would probably be taken off at least 4 to 6 weeks, and if I need longer, they'll give me longer. But she said it will at least be between 4 to 6 weeks. So, and she told me about the like family medical leave papers. She said when they set up a date, then I can call my job and get those papers, and I can bring those papers in at any time, and they will fax them to the job. So she told me, don't worry about that. She said I can drop those papers off at any time, and they will ship them. They will fax them to the job. So she said that won't take no time. So, and I mean, that's it. So it looks like it's moving along, and it looked like that the surgery, hopefully, like the mammogram and everything goes well, and everything checks out, and blood work and everything. Then it looks like it will probably be sometime in September. So that's what my pre-op appointment was all about. Just a lot of talking and signing release forms and stuff like that. I signed some forms, and to say that they told me about the surgery, they told me about the complications, they told it, just stuff like that, and that's basically it. Them taking more pictures of me and stuff like that. So I guess we'll see what happens from here. I just wanted to do a quick check-in, and today when I went, my weight was 184. So that's my update on my weight, and that's my update on my soon-to-be skin surgery from having the weight loss surgery. So the next step, guys. Just wanted to give you a check in, and just in case any of you guys sorry, somebody was sending me a text, thinking about having it, I just want to share everything. And it was funny because I say this, that the surgeon was even surprised that they approved the breast part of the surgery. He was like, oh wow, that's great. Like, you know what I mean? So, because he said sometimes they think with the breast, sometimes they say that it's cosmetic, or they want them to, for whatever he said, the number, I forget what he said, but he said usually the number that they gave, they usually say they want to be able to take out the insurance requires them to take out more or something. And I was like, I wouldn't have no chest then. But he said, yeah, but it's great. It's great that they did it. He was acting like he was a little shocked. Because the lady had told me, we're just going to put this stuff in. And like, if they approve, they approve it. If they don't, they don't. We just got to see, what they do. Insurance companies are all about the money, So I guess, things was meant to be, I guess. I just believe that, things work out. But just giving you guys an update. If there's anything you want to know, I'll try to keep you updated on every step of my skin surgery, and let you know, if it happens, if it don't happen, and just the whole process of it. Okay. Thanks, guys. Love you. Have a good night. Bye.